I'm Brian Roundtree. I'm from Thibodaux, born and raised. And my cancer story is I was diagnosed with Hodgkin's lymphoma when I was 37 years old. I basically had no underlying health issues with this diagnosis, so it kind of caught me and my family off guard. I had a lymph node that presented on the side of my neck that I found shaving in the shower one day, and that's kind of where it all started. I ultimately ended up getting a definitive diagnosis of Hodgkin's and ended up doing all of my treatment here in Thibodaux with the cancer team that they have, which was probably the best decision I ever made. It allowed me to be able to be around my family and my support system, and also be able to see my kids and be able to go to work and do all that without having to worry about traveling and stuff like that. So really, really fortunate that this was an opportunity that Thibodaux offered from a healthcare standpoint. As far as my diagnosis goes, I don't have any family history of any type of lymphoma whatsoever. Family history of some of the elderly in my family in the past getting diagnosed with some of the more prevalent forms of cancer, whether it was colon or breast or something like that. But to say any family history of younger people getting diagnosed with cancer, particularly a blood type of cancer, leukemia, lymphoma, that was not the case. So this was kind of just out of left field. Once we got a definitive diagnosis of Hodgkin's, the blueprint was pretty much there. So naturally, you're going to try and do what's best for you and your family from a survival standpoint. And I did a good bit of research, and my wife was instrumental in doing the same. And we come to the conclusion that no matter where you were going to go, even some of the clinical trials that they were doing elsewhere, you know, people talk about MD Anderson and stuff like that, the treatment protocols were consistent with what they were doing here in town, and those were proven methods. So once we gathered all that information, it was a no-brainer, especially with the facilities and the team that they had here, to go ahead and pursue my treatment here. So with Hodgkin's, they stage you on different stages, and that determines how much chemo, radiation, etc. that they're going to recommend. And with mine, it was stage 2, so I ended up having to do 4 rounds of chemo, but 1 round consists of 2 treatments, so they kind of, a round is like a month, you go every 2 weeks. So I ended up doing 4 treatments, which was 2 rounds. And in my interim part, I did a PET scan to see how the chemo was working. And believe it or not, at the halfway point, I was already in remission, which was outstanding news. I remember that day. When you find out you have cancer, it's very sobering, obviously, but the toughest part was thinking about the possibility of losing my hair. With the chemo regimen that I went through, it's called ABVD, and the adriamycin is also known as the Red Devil, as most of the cancer patients know, and it's known to cause hair loss. But the toughest part was probably my kids at the time were 5 and 3, and my wife was actually pregnant for my baby girl. She was 6 months into her pregnancy when I found out my diagnosis. Was just, if I was going to lose my hair, you know, having to explain to the kids. My oldest was 5. He would definitely know what was going on there, but thankfully, looking back on it, I ended up not losing the hair, which was a blessing. It was awfully thin at the back end of treatment, but I never had to go and cross that bridge. So that was one of the toughest mental hurdles I think I had, thinking that and the uncertainty of that. I guess you don't realize how strong you are as a person, and looking back on it, nowadays, that's something that, you know, I wouldn't say I would do it again, but it was definitely something that put me in a better place in my life, in my faith, and, you know, just moving forward, finding out a little bit more about myself as a person, for sure. I had some relationships with some guys in my life. A classmate of mine, when I was in high school who was a sophomore that got diagnosed, but it was non-Hodgkin's lymphoma. And first person I called was him, and because we're still friends to this day. My advice to someone that receives a diagnosis, regardless of what it is, would be to try and reach out and find somebody that can mentor you that's been through it, which was helpful to me, speaking to others that have been through similar situations, to know what you can expect from a treatment standpoint, stuff like that. And nowadays everybody Googles, and I'm a sports fanatic, but you know, I was quick to learn that there was some professional athletes that are still currently playing that had beat Hodgkin's lymphoma already in their life. So that was kind of assuring, knowing that. Find common ground on some things that you can relate to, and those will keep you focused on getting to your end goal.